Hey guys, this is FixerMed. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 47 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at the lymphatic drainage of male viscera. Testis and epididymis, lumbar lymph nodes, scrotum, superficial inguinal nodes, penis, skin, superficial inguinal nodes, glands, deep inguinal. Let's next take a look at the lymphatic drainage of female viscera. Ovary and uterine tubes, lumbar lymph nodes, uterus, lateral angle and teres ligament, superficial inguinal lymph nodes, fundus and upper part of the body, lumbar lymph nodes, lower part of the body, external iliac lymph nodes, cervix, external and internal iliac lymph nodes, vagina, superior to hymen, external and internal iliac lymph nodes, inferior to hymen, superficial inguinal lymph nodes, all external genitalia except glans clitoris, superficial inguinal lymph nodes, glans clitoris, deep inguinal lymph nodes. Let's next take a look at the arterial supply of the uterus. The uterus is primarily supplied by the uterine arteries, which originate from the internal iliac artery. The uterine artery crosses the pelvic floor within the transverse cervical ligament at the base of the broad ligament. Near the uterus, it passes superior and anterior to the ureter. It ascends along the lateral wall of the uterus within the broad ligament. The vaginal branch of the uterine artery anastomoses with the vaginal artery. The ovarian branch of the uterine artery anastomoses with the ovarian artery. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 50-year-old male presents with a painless swelling in his right testicle. Upon physical examination, the swelling is confirmed, and ultrasound suggests the presence of a testicular tumor. Which group of lymph nodes is most likely to be the first site of metastasis in this patient? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is E, lumbar nodes. The lymphatic drainage of the testis and epididymis primarily goes to the lumbar para-aortic lymph nodes. These nodes are located along the aorta and are the first site of metastasis for testicular cancers due to their direct lymphatic connection. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Superficial inguinal nodes. These nodes drain the scrotum and external genitalia, not the testis. They are not the primary site for testicular cancer metastasis. B. Deep inguinal nodes. These nodes drain deep structures of the lower limb and parts of the external genitalia, but are not involved in the primary drainage of the testes. C. External iliac nodes. These nodes drain the lower abdominal wall and parts of the pelvic organs, including the bladder, but are not the first site for testicular drainage. D. Internal iliac nodes. These nodes drain pelvic organs such as the prostate and parts of the urethra. They do not directly receive lymphatic drainage from the testes. All right, now that we have covered this question, let's move on to look at the next question. A 35-year-old female presents with a palpable mass in her left breast. Imaging studies reveal a suspicious lesion, and biopsy confirms invasive ductal carcinoma. Which group of lymph nodes is most likely to be involved in the initial metastasis from this breast cancer? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, axillary nodes. Lymphatic drainage from the breast primarily goes to the axillary lymph nodes. These nodes are the first site of metastasis for breast cancer, making them crucial for staging and treatment decisions. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, superficial inguinal nodes. These nodes drain the lower extremities and parts of the external genitalia. They are not involved in the lymphatic drainage of the breast. B, deep inguinal nodes. These nodes drain deep structures of the lower limb and are not involved in breast lymphatic drainage. D, internal iliac nodes. These nodes drain pelvic organs such as the uterus, cervix, and upper vagina. They are not directly involved in breast lymphatic drainage. E, lumbar nodes. These nodes primarily receive lymphatic drainage from the pelvic viscera and lower limbs. They are not involved in breast lymphatic drainage. All right, now that we have covered this question, let's move on to look at the next question. A 28-year-old female presents with severe pelvic pain and heavy menstrual bleeding. Pelvic ultrasound reveals the presence of multiple uterine fibroids. Which artery is most likely to be the primary blood supply to these fibroids? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, uterine artery. Uterine fibroids are commonly supplied by branches of the uterine artery. This artery provides the majority of blood supply to the uterus and its surrounding structures, making it the primary source of blood for fibroids originating within the uterine wall. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, ovarian artery. While the ovarian artery contributes to the blood supply of the uterus, it is not typically the primary blood supply for uterine fibroids. B, vaginal artery. The vaginal artery primarily supplies blood to the vagina and may contribute to the blood supply of the uterus, but is not the primary artery involved in uterine fibroid vascularization. D, internal iliac artery. The internal iliac artery gives rise to several branches that supply pelvic organs, including the uterus. However, the uterine artery is the primary vessel responsible for supplying blood to uterine fibroids. E, inferior epigastric artery. This artery supplies blood to the lower abdominal wall and is not directly involved in the arterial supply to the uterus or uterine fibroids. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.